you so much for inviting me, and I want to start to congratulate you to this big conference. I can't believe you have over 400 nurses in this beautiful city, so thank you so much for inviting me. Coming from Sweden, where it was cold and, not snow, but cold and rainy when I left early yesterday. I will talk about leading the team, collaboration and communication in cancer care. And when I thought about this title, for me it's all about safety. Safety for our patients, safety for ourselves and our working conditions. And I was glad to see that in your exhibition here you had a lot of companies displaying different safety devices that you as nurses can use to protect yourself and your patients. So that's very good. First of all, before we start the serious things, I want to say hello greetings from the whole EON's team. We met for the European Cancer Nursing Day in Prague a couple of weeks ago. I enlarged this picture so it's quite blurred, but you recognize some of the people are actually here in the room as well. But we had a great day in Prague, so everybody says hello to you. And first, I want to talk a little bit about cancer care in Europe and why we need strong nursing leadership. You will know this, of course, but I just want to highlight some of the points. We have increasing cancer incidence and prevalence. So more and more people will have cancer, but also more and more people will live with cancer. Something that's very, very positive is the recent years' improvements in treatment with all the new treatment options we have. So we have a lot more to offer to our patients, but they're very complex, many of these treatments, so they also involve risks when it comes to safety. And you all are painfully aware of what type of drugs we use in cancer care. They're very potent and often come with severe toxicity. Our patients are vulnerable. We have new drugs and oral therapies, which is of course good. The new drugs, when I was a new nurse, back in the Stone Age, 1985, every nurse knew all the pills, right? You just by looking at them, you knew all the pills. Nobody knows that today, and not even in cancer care, because we have so many new drugs. We also treat our patients more in outpatient settings, outside the cancer centers and sometimes in primary care or at home, which is positive for our patients, but also less control from the healthcare. In many countries we suffer with nurse shortages, financial issues all across Europe, Brexit, whenever that will happen and however it will be, we don't know. And also unmet needs among our patients. For instance, when it comes to availability, inequalities, patient involvement, and self-care management. So we need strong leadership, strong nursing leadership, both on local, in our own hospitals and institutes or workplaces, in our regions, nationally and also internationally. And I will try during these 20 minutes to combine and talk about all these four levels of nursing leadership. I hope it's not going to be too confusing. But first a little bit about the impact of cancer nursing. We're the largest professional group in healthcare in most countries, nearly every country, and we are also the most trusted profession, which is a great privilege, of course, but it also comes with responsibilities. We work very closely with our patients and their families and friends, and nurses are involved from prevention and screening all the way to end-of-life care. We have a large variety of tasks, So we are involved with everything from patient education to lifestyle changes. But our work is not always recognized. So we need to change that. And we need to change that, because no one else will change it for us. These are just 3 headlines that I found last month when I'm on Google. The first one is from the US. Nurses are ranked the most trusted profession. The same day, also in UK, nurses once again tops the charts of most trusted profession. And this one to the left that you can't read is in Swedish. Says the same thing. Most people trust nurses. I don't know in Spanish because I can't read Spanish. So what role do we have in safety and patient safety? Well, we all know that mistakes and errors happen during every phase of the complex administration process of the drugs we use. So from the pharmacy, transports, preparation, administration, follow-up, we know, prescription, every step, mistakes and errors occur. But as nurses, we're very often the last point of contact before the drug meets the patient, because we are preparing and administering the drugs. So our actions and our skills here is very important. The way we act can make a big difference. We can actually stop a lot of these mistakes and errors if we act and speak up when we see and hear that something is or seems wrong. So we have a unique role to optimize patient safety as nurses. And when we do speak up, of course, people need to listen. Otherwise, we will not speak up next time we see something wrong. So how can we ensure effective teamwork through good leadership? Well, as nurse leaders, and I think all of us are leaders, we should put safety and quality first. Not put financial issues first. Because if we put safety and quality first and focus on that, we will also gain when it comes to staffing and finance, etc., because they are connected. We need to promote systematic work procedures so that people are following the protocols and feel safe in doing so. And then this is a bit of a complicated sentence, but I will explain. We need to encourage heterogeneity among team members. When we work in teams in healthcare, many of us think, well, I want to work with this or that person because we are so similar. We like working together, right? But actually, a team that's really efficient has differences. So if we have very different backgrounds, different skills, different competencies, we are more likely to solve difficult problems that we might face in healthcare. So actually we should say, I want to work with this or that person because they're very different to me. We also need to pay close attention to the workplace culture. I will come back more to the cultural issues. And we can ask for feedback from our team members. Please let me know if something I do that you don't understand or that seems strange or wrong. And also to acknowledge our own mistakes. Everybody makes mistakes. So when a conflict or mistakes occur in healthcare, because they will do in every team, don't ask what happened. Or ask what happened, sorry. But don't ask who made a mistake. Try to avoid blaming somebody. Instead, try to focus on solutions. How can we address this together? What can we learn from this so it shouldn't happen again? Then people would feel safe to speak up next time something happens. Also, something we need to be better at, I think, it's to encourage and to provide feedback. That's very difficult. maybe it's different here in Spain, but in Sweden we tend to give positive feedback to other people instead of the people that really are involved. And negative feedback, again, not at all or to other people. It's very difficult. But I think we need to be better at that. Feedback, and if we train to give regularly, to give positive feedback to our colleagues, it can be very simple. At the end of the shift, saying, I really appreciated that you helped me and with this or that, whatever it was. If we do that on a regular basis, it's also easier to say, well, actually, I needed your help more than I could have done with more help from you, or something maybe not as positive as well. And I think we need to practice here. And when we give feedback, we need to be specific and constructive. You know, managers that said, oh, you're so fantastic, all of you. It doesn't really work. You need to know what it is you do that people like, exactly what it is. And something you can do as well is use a method called a critical friend. If you're going to do something difficult, ask a person you trust to be your critical friend and talk about it before and say, can you please give me feedback? Look particularly on that, this and the other, because I feel that I'm not so good at that. And then you can do the same for the other people. That's a way of making it not so difficult with feedback. You also need to evaluate your own and your team's work. Measure it in patient outcome and experiences. I know we'll talk more about that. And discuss the results with the team. And make plans together for improvements, and make sure you recognize and reward the success. Sometimes we go to conferences somewhere else to present our successes, but we forget to celebrate them with our own team. And also be a role model. You don't choose if you are a role model or not. Other people decide if you're a role model. But as a role model, as a senior person, you become a role model if you demonstrate confidence and leadership. Sometimes you might even not believe it in yourself, but try to show it anyway. Don't be afraid to be unique, to stand out. Communicate and interact with everyone. If you think about the people you see as your role model, they very often do these things. They show respect, they communicate and interact with everyone. They dare to leave their comfort zone, and they encourage others to develop. Leadership is not to be better than your team, it's to encourage everybody to grow. And show commitment. I would say nurses are extremely committed at work, and it's also important to show commitment outside of work. Something else that's very important is to look after our health. Your own and your team members. We know that nurses are not, in general, very healthy. We are very good at looking after others, but not after ourselves. And we need to do that, to last, to avoid the negative consequences. The physical well-being, like physical activities, diet, avoiding too much alcohol, avoiding tobacco, etc., is something we really need to work on to be healthier. But also our psychological well-being. How many of you have felt compassion fatigue or burnout symptoms now or previously? How many of you have experienced? Yeah, more and more hands, yes. More than half of you, I can say, yes. And be very prone, as cancer nurses, there's a high risk that we will be burnt out or have compassion fatigue. And there's a lot to learn on how to avoid that. And something we can do is try to set up systems for mentorship and counseling within our organization, but also to look at the well-being with the physical well-being, for instance, make sure we don't work too much, etc. And we have a bad reputation among other groups. They say that nurses eat their own, meaning that we don't treat young people, our young colleagues, so well. I don't know if you recognize that. Yeah. You're going to hear more about that from Sarah, I know for sure. And I met Sarah and her team in Lisbon not so long ago, and they told me some horrible stories from all over Europe. So let's stop doing that and take care of our younger colleagues. And there's a picture here of Lemelis. She comes from Estonia. She won an award from EONS last year, the RECAN Award, recognizing European cancer nursing. She was so happy because she spoke up and made a big change in her country. But when she came back, nobody wanted to hear about her award. Her colleagues didn't say anything. She didn't even dare to put the certificate up at work. Her colleagues totally ignored that, which is sad, I think. Communication is complicated, always, but in hospitals or in healthcare it's very complicated. Many people are involved in one patient's care and interact and communicate. And every problem with communication between two people within this complicated system can have a negative effect of the outcome. So effective communication is difficult. It's more than just delivering a message. Everyone here, right now for instance, you have your own experience and references, and it's different how you see different things that I say. And whatever you feed back to me, I can see differently depending on my references and history. So it's complex. And when we're stressed, our communication skills go right down. That's when we need to be in the sharp end of communication. We need to be really good, and actually we're not so good. And we talk often about communication being one of the most important part of healthcare, but still we don't have a lot of training. We train to communicate with patients and family members, but most of us don't have so much training in professional communication. Something else important is active listening. So encourage your team member to share their thoughts, don't interrupt, ask questions. Show understanding by repetition. So you say, oh, so you mean that, and you sort of conclude, and in that way people hear that you understand. 5 minutes, okay? Don't let any team member dominate communications, and be aware of non-verbal communication as well. Collaboration and communication. Make sure that you communicate your vision on how do you want healthcare in your team to be. People might think, or you might think that people know, but they might not do. So communicate your vision even if people don't ask you about it. And speak up. I think I've said speak up 4 times already. And avoid what's called the doctor-nurse game. It's the old tradition where nurses had a passive role and didn't have a responsibility, and doctors had an overarching leading role, treating nurses as assistants. But we also play, we tend to blame this game on the doctors, but we also play this game. So let's avoid the doctor-nurse game. If you're interested in this, there's a lot to read. Just Google doctor-nurse game and you'll see a lot of papers on this topic. Instead, we should work together, what we call interprofessional learning and collaboration, in education and in clinical practice and also in research. We should not be the research assistants to our medical colleagues, we should do research together. And how do we improve the collaboration with our physicians? Well, first of all, don't apologize when you ask them to do the job. If you disturb somebody, disturb when somebody is on call. Don't say, I'm very sorry to disturb you. When you get invited to collaborate, accept before you even think about it. Worry about the consequences later. Demand, which is very difficult, the same policies and recognitions for everyone. Regarding names, for instance, very often the doctor's surnames are presented and the nurse's first name, for instance. and never say, I'm just a nurse. When it comes to coordination of care, this is an area that's very underestimated in healthcare, and we published a paper a couple of years ago called Working in Silos, meaning the teams, like the different pieces of puzzle, it works really well in this team and this team and this team, but we don't work together. And nurses have a very key role here. And in psychological safety, in the concept of psychological safety, Amy Edmondson, there's a quote here from her. She said, different departments and professions may have conflicting priorities about what service to provide and at what time. We must coordinate our actions for safe and high quality care. So it's very important to recognize coordination as a key part of healthcare. I'll hurry up, I promise. So psychological safety is something that really helps the team. It's been research done at Google, for instance. They looked at Google and saw that some of the teams working for Google were very successful while others were not. And the difference was the successful team, they had high psychological safety. That means that team members feel that they can speak up without getting punished. They have no fear for negative consequences, and this plays an important role for workplace effectiveness. So how do you establish this psychological safety? Well, you encourage all team members to contribute with their ideas. And when they do, you acknowledge and appreciate. You don't steal the idea. And this is a powerful tactic for inspiring others to follow, because they will follow them. And the team leader, they communicate the norm, but all of the team members can shape and develop this. And action speaks louder than words. So you will gain high levels of engagement, increased motivation, learning and development, better performance, creativity, outside-the-box thinking and strategic thinking, which is components for safer cancer care and improved working conditions, because they very often go hand in hand. So in our European experience within EONS, we are doing studies that we call RECAN, recognizing European cancer nursing, and we find that cancer nurses they love their jobs, they're very important work, but they're overloaded with work. And we find between different countries differences in recognition, for instance, and career possibilities. So what we're doing right now in EONS, we work really hard with our strategic work to gain recognition, and our goal is to get cancer nursing recognized as a specialty across Europe. So every country recognizes cancer nursing as a specialty. And right now, I said we do it quite well. Big task, but we're doing quite well. And why is this so important? Well, with specialized training for cancer nurses, we will improve the quality, the safety, the patient experience. There's massive research supporting this. We will have more career possibilities for our nurses, better healthcare research and implementation, because we know that specialized nurses do more research. We have lower turnover rates, and this would support mobility and movement between countries, because if they have the same education. And it will retain the best in the profession. So it's a win-win for everyone. But the regulations need to be changed, which is not easy, of course, but we have a strong case, if you ask me. So we just released a couple of weeks the EONS Safety Manifesto for improved safety in cancer care, and it's these 4 messages. Always use safety protection, always avoid contact when you're trying to be pregnant or are pregnant or breastfeeding. Inform your patient so they will ask questions if something seems wrong, and always speak up. So remember, every cancer nurse is a leader. And finally, I will just talk 10 seconds about the next EONS event that will be in Barcelona in September. It's the EONS 12 Congress at a big ESMO conference, and I hope to see many of you there. We have a 3-day full cancer nursing program. We have a lower rate for nurses, only for nurses. And you would have access to the whole ESMO Congress and on-site translations into Spanish. We have seminars, workshops, posters, a lounge, social events, and you can register at E.ON's webpage if you want. So, that's it. Thank you.